So, welcome back to the V Movement podcast. I am super excited because we are here with Holly Wilson. She is amazing and just super excited that she is here to talk about her journey, her experience, and we'll be getting into more to that. But I wanted to introduce Holly. Holly is the owner of Liberty Fitness in Eureka. She is an amazing personal trainer. I get workouts from her and have gotten so much stronger. I can do 2 pull-ups. Woo! When I could do barely one. So I'm super excited. So Holly has helped me get there. And Holly has so many amazing certifications and she's super knowledgeable. She is a personal trainer with ACSM. She has done the Girls Gone Strong certification, so pre-postnatal certification, and also the women's health coaching certification. She's got a nutrition certification through Precision, and she's working on her yoga 200-hour certification. She is an amazing singer, and I can't wait for her to post, and love seeing what you've got on Instagram. And then you're also working towards getting your master's in library science. That's a crap ton, and she's doing amazing.
Thank you.
Yeah. So
it sounds way cooler when I hear it from someone else.
You've done so much, and you're only 33?
I'm 33 this July. Yeah, later this month.
That's right. Okay. You're still 32, so you still have a few.
Yeah, I've got a few days.
There you go.
3 weeks, probably. What is that? Yeah, a few weeks.
Oh, yeah. Yeah, I've had the pleasure of working with Holly and knowing Holly, and I actually teach Pilates, a little plug, on Monday nights at 5:45 at Liberty. So it's been cool to have that opportunity to get back to teaching. But Holly, over the time that I've known her, has shared with me her story about her pelvic health challenges, and she is graciously willing to come on and talk about it because this is a conversation that needs to happen. So many people need to know that there are other people out there that have pelvic pain, have issues with bladder, and knowing that we can all talk about it. And the more that we talk, the better that everyone learns. And also, we also push the medical system to learn about it too, because the more that people speak up, the more that doctors will start to do more education, researchers will start to do more education. It's big. So I really appreciate you coming on, Holly.
Yeah, I'm excited. And that's part of the reason I want to do library science, because I want to learn how to really access like studies and do analysis of those and compile data and stuff, because I don't feel like a lot of that is accessible just on the patient end. And so a lot of that has to go into taking it into our own hands at this point, and hopefully it'll get better. But right now it's grassroots thing.
Mm-hmm. Yeah, and there's a payment wall to it too. Like for people to be able to access it, you can go on, why am I blanking? NCBI, whatever the research, the main research.
I can think of it. I can picture like the logo and everything, but
yeah,
can't think of the acronym.
Right. But there, it's you have to pay for the article, and honestly, a lot of that stuff is just stuff that regular people just don't understand. And sometimes I look at it, I'm like, I don't know what they're saying. So. Yeah. There's a lot of information out there. And so that'd be awesome to hear that that's what part of the reason why you're going into that field. So that's really cool. Yeah. So I'm going to open up the floor to you and just let you talk about what your pelvic health journey is and letting people know what it is that you're experiencing.
Yeah. So I started having really painful periods just from the get-go. I remember just being debilitated by them and laying around and just writhing around in pain and stuff. And my mother had the same thing. So I thought that was just normal. I just thought like when people were talking about period pain, that's what they were talking about. And it turns out that it's more frequent than it should be with people. There are many more women suffering with really, really debilitating cramps, and it's normalized, but it's not a normal thing for your body. I think I was 27 or 28 when I finally got diagnosed with endometriosis. I'd been pretty positive for a while. I'd go from being very fit, I would have a flat stomach, and then all of a sudden my belly would be distended and I'd be throwing up from pain, and ibuprofen didn't work. I would just basically be laying on the couch for my period and just in a lot of pain with it. I have my heat pack for my feet right now, but that used I would get it super duper hot and I would just lay it across my stomach and feeling the heat, like it would be painful in that way, but it wasn't as painful as the cramps. That's about the best that I found until I
Yeah.
found recently a little pulse thing that helps with cramps. But it was really frustrating because for years it was just dismissed when I would talk about it. I was told the most frustrating one was it's not reproductive. And so it was really confusing to me because it would come with my cycles and I was like, what? It's not? I
Oh,
feel like this is very cyclic and told
said,
no.
yeah. So
Yeah.
a doctor told you your cramps and pain was not because of your cycle?
Yes.
Oh,
Yeah, they
oh,
said this isn't reproductive. And that was early on enough to where I didn't know to question and be like, but why? And so I did try birth controls. Those made me really sick. So I couldn't use them. At one point, we didn't know it was birth control that was making me sick, but like my skin was turning yellow and I had to get glasses. I don't need glasses anymore. To get glasses because I'd be seeing double vision while I was teaching later in the day. It was while I was teaching 5th grade. And yeah, it was wild because it it just seemed like everything that I was experiencing would get dismissed. And I think eventually I was able to get people to or providers to start considering that it could be endometriosis. I had read this book called The Period Repair Manual, and I couldn't believe that my symptoms were somewhere in a book. And so I started taking magnesium and I started trying these different things that were recommended in the book and started equipping myself with how to talk to providers. That's another really good part of that book. It's by Laura Brydon.
mm,
And she talks about how to talk to providers and how to sift through your period problems. Could it be PCOS or endometriosis or adenomyosis? And I was pretty confident that it was endometriosis. And so I ended up at Stanford and I had a not really great experience with the first person because it was a lot of pushing medications. And I understand why, because that is the first line of defense. But I did advocate that I felt that we should get to the bottom of it, whether or not I wanted kids, because that's another thing is, oh, we'll put you on birth control. And then when you're ready to have kids, we'll sort through this. And I said,
mm.
I'm not probably having kids. And I would like to know because this is my body. And so I moved on to a different provider and I ended up getting excision surgery. And that's the way to confirm it is through laparoscopic surgery because I'm trying to remember now. You can possibly see it on an MRI. It's like a 50-50 chance. And that's what the doctor said was it's a 50-50 chance we'll be able to see anything. And I felt like, why don't we just do it regardless? Because if we're still going to have to do surgery, let's just do it and skip the MRI. So she was willing to do that. And there was endometriosis. And I think it had a twisted fallopian tube and stuff. So she was able to get that out and untangle that. And I think there were a couple cysts. I can't remember on that part, but there was endometriosis. And what was funny to me was I got this surgery and everything, and the recovery was less painful than my periods.
Wow.
So I didn't have bloating afterwards. There was slight. And then it was just a really for me, it was a simple recovery. I know that's not the case for everyone, but I was very, very relieved to know that this thing that I had been so sure I had for a really long time that had been dismissed and not listened to and not taken seriously. I was just so relieved that I was right. And it was such a privilege to be able to get the surgery in the first place because insurance is so challenging that I had to postpone the surgery at one point because they couldn't tell me if it was for sure covered. And
Mm.
I had great health insurance through teaching, and they said that they would let me know afterwards if it was deemed medically necessary. I was curious, okay, if they don't feel it's medically necessary, and I don't know what that would have been like if they didn't find it, but still we wouldn't have known if we didn't go in. Said it would
Right.
have been $150,000. And I was like, I can't do a surgery that you might not pay for that's that expensive. So luckily I had someone on the line that was really um she was amazing. And she basically promised, but she gave me her name and stuff. And
The
she
insurance
said,
company?
yes. She saw that I was her son's age and I was like crying on the phone, like, I need this surgery, but I can't get it if I don't know that it's going to be covered because that would be financially ruinous to do that. Like,
Yeah.
that's crazy to me. And so she was like, this will be, and it was. But
Oh,
what a horrible thing to put people in of it might be covered, it might not. We'll decide after you do the surgery. So I got lucky there and I felt really grateful that I was even able to get the surgery. That is how I started getting more confident in knowing I had endometriosis was other women that had either had excision surgery or had experiences. They're the ones that shared that book with me that told me you need to find an excision specialist because you don't want to do ablation and like what the gold standard was, how to find someone. And I ended up with this wonderful, wonderful provider that was able to do that and was an excision specialist. And I wouldn't have known anything. I wouldn't have even probably gotten the surgery if I hadn't known that there was a good
yeah.
option for me. So
How did you find that surgeon? Was it through Stanford or how did you
it
get connected
was,
with that?
yeah, it was through Stanford. And I was in a counseling appointment after that first specialist. And I told my counselor, I was like, I do not want to go back to the same person because I just don't feel comfortable with her doing a surgery in my body when she wouldn't even listen to me during that first session. And that's another thing I've found is you do have the right to not have someone
Yeah.
touch your body.
Yeah.
Not all clinics, like I've since had trouble at a different clinic where they don't allow you to switch providers and stuff, but this one they do. And so my counselor looked up just different providers on her end for me, and I told her what I was looking for, and she sent me the name of Dr. Lum, and then I looked up her profile and stuff and on Stanford of what she's done and who she is, and I was like, that's who I want to see. And so I did. And she's been amazing. I love her. She's been wonderful. And she was so reassuring during the, I don't know what you would call it, pre-op, where they come visit you in the hospital bed because I was scared. I was crying the whole time. And I was just terrified. And she had the different people that were going to be in the surgery room and stuff come meet me. And she came in to answer any questions because she knew I was totally terrified. I've never done anything like that. And I was positive I was going to die. It's not a risky surgery, but they give you that disclaimer at the beginning. And so of course I was like, that's going to be me. They were just so amazing and helpful and comforting and sweet that it totally put me at ease. And I feel like I would probably do it again if I had to, but I don't see that I would need to because now I know what I have and I know my best options at this point for managing it. And I started seeing a Chinese medicine doctor in San Francisco, and that's been a game changer because it's just such a more holistic approach. And I really appreciate what Stanford has done for me. They've been so great at helping me get my diagnoses and everything. But even I got a second opinion at UCSF as well, just to make sure that we weren't missing anything. And both Stanford and UCSF were like, yeah, you should go see an Eastern medicine doctor because there is only so much that Western can do. And it's kind of like we've reached that with what we can do. I've had the surgery. I can't do birth control. And there's only so much that they can help with. And they've done that. And going to Wu's Healing Center is the name of it. And she's amazing. She used to teach at SF State. And I've gone at this point twice, but she gives you homework in between. So you have to take these herbs. And I have the moxa stick that I light and I do over my tummy and then over a couple spots that the acupuncturist wants me to do it. And when you go in, you get forget what the actual name is, but they go in and they acupressure your
Like
stomach.
deep.
Yeah.
Essentially
Yes.
massage, but more technical
Yeah.
than that.
Yeah. And it is deep and it is uncomfortable, but both times I've left feeling better than when I walked in, which I've never had that experience. And so that was amazing. And yeah, I've just been really happy with that place. it's been a really good thing.
I want to back up for a second with
Back it up.
Yeah, back it up. So you've been having painful periods ever since you started your cycle? Since
Yeah.
like, how old were you when you started?
I was 12 or 13.
Mm,
I was in middle school.
middle school,
Yeah.
yeah. So when you had your period, were you having to stay home from school and was
Yeah,
it
I would
to
try
that
and go to
extent?
school because I loved school, but there were days that I would stay home from school. I don't know. I thought it was more normal, so I would push myself more than I should have.
Mm,
Even I think my first time ever missing work for period cramps was as a teacher, my second year of teaching. I just didn't want to miss ever for that. And I wish I had been gentler with myself, but I just thought that I was being dramatic and that everyone deals with this. So I should be going and stuff. And now I see that it was a much higher pain level than I realized was normal for a period.
yeah. And I'm sure people around you probably thought you were dramatic as well. And that's the story, like, oh, you're on your cycle. Oh, it's an
Yeah.
excuse.
I remember
Yeah.
having cramps so bad. I was at College of the Redwoods when I was doing track, and I was trying to get home, and it was only like 15 minutes from my house, but I ended up stuck at Humboldt Hill Lookout. Like I made it from CR to Humboldt Hill, like five minutes probably. And I had to have an ambulance come get me because I couldn't move. It was just so painful. And those ones, like the ones where I've ended up in the hospital, typically were ovarian cysts rupturing.
Mm.
But yeah, I didn't know what those were at first. The very first time I had one, I think it was 18 or 19. I'm sure I had them previously, but I didn't recognize it as pain, as like, this is a 10 out of 10 pain. And so the first time we went, I had my dad take me to my doctor, and they thought I was they thought I had an appendix rupture, like that I needed to get to the hospital right away and all that. And it was a cyst rupture, but there was no education about it. I had never even heard of someone having a cyst rupture. I was like, what is it? What? And
So did they go
and
in
they
and take out your appendix? Did they do a surgery?
No,
No.
no,
Okay.
luckily they didn't. They did scans and stuff, and they came back with, "We can't find anything, and we think this is a ruptured cyst." And they gave me, I think they prescribed pain medications or something, because we went to Walgreens, and I was still so sick that I ended up projectile vomiting in the book.
Oh, that's
And,
intense. Yeah,
yeah,
intense pain. Yeah.
yes. Yeah, and I just was like, when people talk about painful periods, this is what they're talking about, and women just have these, and no one ever mentioned no providers. It was always, you have to be proactive if you want help with it, because
Yeah.
it it just isn't something that
Is on
seems,
their
I mean,
radar.
once you get to a specialist or something like that, it's more recognizable to them, but a lot of times it feels like it just is, oh yeah, that's normal. It's
Yeah.
common, but it shouldn't be considered normal.
Yeah, I feel like I don't I don't remember learning about endometriosis really until I think I saw a commercial with man, one of the gals who's Dancing with the Stars. She was promoting some kind of medication, but she was talking about her endometriosis, and that was the first time that I remember hearing about
Oh,
that. And that
yeah.
was probably I don't it was recent, like within the last 10 years, I feel. So yeah, so I feel like it's more on people's radar, but it's still not well
Yeah.
researched. And there's not a lot of specialists that do the surgery. And there are people who say they do, but really going to a specialist or at least getting a second
Yeah.
opinion like you did is really big because a lot of times they'll be like, oh, let's just do a hysterectomy or let's take
Yeah.
out the ovaries and that'll get rid of the pain. And unfortunately, that doesn't always happen. And sometimes they don't get everything. I'm curious
Yeah.
when you had your excision surgery, did they say were they able to get all of the endometriosis that they could see or
Yeah. They took out what they could see, and I did have my pain return 3 months later. So I had a few good just mellow periods that are probably more like what I should expect. And then I had a cyst rupture, and I ended up in the hospital, and then that was the start of, who knows? There are different ways that you can get SIBO, which I ended up getting, but I had the cyst rupture, and it was after surgery, and then the swelling and the bloating and like all of that never went away. We kept trying to figure out, is this endometriosis or what? And it looks like, I don't know how I got SIBO, but I had never had any dietary or just GI distress until I had that cyst rupture, and then it turned out I also had SIBO. And so I don't know if I got it from surgery. Even if I did, I do not blame anyone. That's just, I wanted the surgery. That's on me. But
no,
I knew there were risks. I wish that, yeah, I knew there were risks. I'm happy I did it, but I don't know if I got SIBO from that or if I got and SIBO is small intestinal bacterial overgrowth. I'm on another treatment for that. And so hopefully it'll be eradicated. But that's another thing that I'm excited to work with my Chinese medicine doctor on, because I've done these antibiotics a few times and I don't want to keep doing antibiotics, but there isn't really any sort of clear path to getting rid of it. So that all started after my surgery.
It's a journey, that's for sure. And SIBO is another thing that's not really well researched too. And I didn't learn about SIBO until I started doing my pelvic health physical therapy stuff. So it's something that's not on people's radar either. So that's great that you were able to finally get the breath test and do it was on their radar to even look at that. Because had you heard of SIBO prior to getting the diagnosis?
No.
Okay.
No. I actually, I was so sick when they prescribed me the breath test that I put it off, because I said, what did I tell them? Oh, I was like, I've never had GI issues. This has to be endometriosis related. And then I was so sick that I couldn't eat consistently. And so you have to eat a specific diet. And I think it's the day or the week before or something. And I just couldn't adhere to it. And finally, when I was well enough to do it, I was able to do I think it was like rice and eggs and like just really specific foods. And then it came back positive. And so I did the treatment. The first treatment was so effective. One of the things, not everyone gains weight with SIBO. Most people lose it, but some, like, they'll have just a rapid weight loss when they get SIBO, because it impacts your absorption of nutrients and all of that. I did have trouble with absorbing nutrients. I had to get a iron infusion, and I've since had one more. But the first treatment, all of the weight that had come on from SIBO just went away in a week. It was very wild. I felt some validation there, because I just was used to a much lower maintenance weight where I don't have to think about it. Nothing had changed. And then suddenly, just in the span of from when that cyst ruptured until it just didn't go away. And my doctors were telling me I needed to work out more and eat better. And I said, nothing changed. I'm still eating well, and I can't work out now because my stomach hurts and I can't eat. And so it was interesting to be on the other side of having never had a provider make an assumption from looking at me. Like, they always assumed that since I was petite and trim and doing all my athletics, that, oh, she's doing the right things. And then as soon as I gained weight, it was like, oh, you're not working out enough. So that was keeping me from getting any help, because they just assumed that it was habits. It also gave me so much empathy for people that work so hard in the gym and work so hard in life and are just dismissed because their body hasn't changed, when there's literally nothing I can do. I'm at that same weight-ish right now, and I just have to wait until the SIBO's gone, because it has nothing to do with my habits. It has nothing to do with my exercise. I can't wait to start exercising again once the fatigue lifts a little bit. But it was very eye-opening to me to see what it's like to have a larger body and go into the medical system and it be more like, oh, it's your fault that you're this way.
Yeah.
Yeah, that
Yeah.
was discouraging. And so I've been sharing a lot more about just the different things that I've learned so that other people can know, like, there are conditions that impact your weight that you have no control over it, because there was a lot of self-loathing, like, why can I not seem to feel good in my body anymore? And there's this bacterial overgrowth that I'd never heard of happening, and I'm being told that I'm not working hard enough when, yeah.
Yeah. Yeah. No, yeah.
Yeah.
It's a story that a lot of people have for sure.
Yeah.
And it sucks. Yeah.
It hit home also because one of the big things at Liberty Fitness is we don't want weight loss. It's fine if that's your goal and stuff, but we're never going to guarantee that you're going to have body changes because it's not really always in your control. And we will support you through it. We'll support you getting medical care. And I have people where they tell me what they're eating and stuff, and I know their activity level and things. And it's like, you are putting in the work. Like, this is something you should talk to your doctor about, because
Yeah.
if your goal is weight loss, you are doing the thing that you would need to do to see body composition changes. And there might be something going on. So, like, it might not happen in the gym. It might end up happening through intervention for a medical thing that you didn't even know what was going on. Bodies are bodies. We don't need to have them fit a certain. If it turns out that my maintenance weight is this, I would probably be fine with it. But right now, I know that there's not really a conscious weight loss thing happening right now. It's just, I need to get healthy and I need to take care of my body and get back into my better routines and just know that I'm doing the best I can.
Yeah. The biggest thing is feeling comfortable in your body
Yeah.
and feeling
Mhm.
comfortable in your mind. I really appreciate you sharing your story. I know so many people will resonate with what you have to share, and it's a journey. It's not like you started here and you ended here and now everything's great. You keep on educating yourself, also like sharing your story, having these discussions with your doctors, which is not easy, and having some pushback and being like, no, this is what I need. That's huge because that's a really hard thing to do.
I've had plenty of counseling sessions that are just coaching me on how to go into a broken system with a mindset that is going to help me instead of just enraging me. With wonderful providers, you're still going to have these hurdles that are super frustrating, or you'll find a wonderful provider and they're not in network. And yeah,
Yeah.
there's so much frustration, but there's also, I I feel like, coming out on this side of it, I'm super proud of just learning how to talk about my conditions with providers and ask questions. And I have a friend who's a physician's assistant, and he was like, just be the squeaky wheel, because that's how you're going to get help. And so that felt good to hear from a provider, because I also don't want to be super just,
You want to be
I don't know.
respectful and
Yeah.
not let them not just dismiss you because you're being,
Yeah.
a pain in the butt, quote unquote. Like, oh, we only have 15 minutes and da 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 da.
Yeah.
Yeah. Yeah. It's a balance of figuring out how to be respectful.
It is really frustrated with the SIBO medication not coming. There was just complications. If anyone's on my personal story, they saw that. But I wrote an apology letter to my GI. I think it was my GI people. Who even knows? But I wrote an apology of, it was the chronic fatigue clinic. I was super mad at them. It was just a frustrating time. And I wrote back and I apologized and stuff. And that's another part of having your relationship with your providers. I was wrong. I needed to apologize for letting my frustrations go out on them when really it wasn't even about, like, they didn't do anything. I just felt that they could have done better in something. And now I see, I was just really angry that day. And so I've also learned how to say sorry instead of holding on to that. No, they should have,
Mhm.
because we all make mistakes and providers do it. I do it, and you have to maintain that relationship in order to get help. So
Yeah.
saying sorry when you have to.
Oh, that's such a good lesson in life for all things.
Yeah, it is.
We are definitely going to have more conversation about this because I think everyone will continue to learn from your story. So if you all enjoyed this episode and know any friends that may relate to Holly's story, send them this episode. The more we all share, the more we all learn and know that we are not alone. Links to follow Holly and more about Liberty Fitness will be in the show notes and the period manual book she referred to as well. As always, remember to keep the V's in your life moving. The information shared in this podcast by Sarah, Allison, and our guest interviews are intended for educational, entertainment, and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. While we are licensed physical therapists, we are not your personal physical therapists, and no patient-provider relationship is formed. If you have any health concerns or questions, please consult your medical provider. The information on this podcast or any of our other platforms is to use at your own risk.